So we've done over 20 cases of fecal transplant here at NYU, and we found that it's been incredibly helpful in terms of treating patients with C. difficile colitis.
Okay.
And so we treat patients who both have recurrent infections and then also patients who have refractory C. diff, so patients who don't respond to antibiotics. Well, the advantage is that it's offered us a line of therapy for patients who otherwise had no other medical treatment options. And so, what we're using it for, the C. diff indication, patients who have recurrent diseases, they will respond to antibiotic treatment, but oftentimes will have a relapse of their condition.
Sure.
And so the only way that they can get control of their symptoms is to be on lifelong antibiotics. And for patients who have refractory C. diff, they don't respond to antibiotics. So for those patients, sometimes the other option is surgery.
Yeah.
So it's provided a new line of therapy where none existed previously.
And what kind of
Yeah. So it's typically a cure, actually. And so, the response rate has been in the high 80s to low 90%. And unless patients require another round of antibiotics, most of them tend to do pretty well and don't have any further infections, which is, really amazing, just given that a lot of these patients who've come to us have had, so many recurrences already. There are some patients that we, recommend the therapy to, and they just haven't heard of it before, so we have to explain it to them.
Yeah.
But for most patients in which the therapy is indicated, they're just so happy to have relief. Fecal transplants have been given, by colonoscopy and upper endoscopy. Sometimes we use the feeding tube, and then also enemas, so recurrent enemas. But we can use either fresh or frozen stool using any of those modalities.